Good day. Thank you for stopping by. We are raising funds to complete the build of VAERS Explorer. VAERS Explorer is a web application and a research tool intended to enable users to explore and analyze vaccine adverse events reported in the Vaccine Adverse Reporting System, VAERS. Then create customized reports via filter selection directly from our website. Additionally, we complement this data mining utility with a rich resource page as a gateway to relevant internationally sourced studies and articles to provide a comprehensive compilation with the intention of aiding confidence to conclusions for opinions and decisions about benefit and risk. Side effects occur with all vaccines, not just COVID-19. Safety concerns have existed from the beginning. There is no avoiding controversy or contention, and this is not an anti-vax application. Concern for vaccine safety and management of potential adverse events goes hand in glove with the benefits of this therapeutic approach. We believe VAERS data, in conjunction with our resource gateway, provides insightful correlation and awareness of potential adverse events that, if not treated early, can worsen and seriously offset vaccine benefits. The official product label discloses known adverse events and risk associated with a particular vaccine, beginning with initial trials and cumulatively through updates from post-market experiences. This information accompanies every dose. However, it may not be fully presented or its significance appreciated by the patient at the time of vaccination. The labels are publicly available online in the NIH database DailyMed, and every label has sections on warnings and precautions and adverse reactions. Although these are not expected with the majority of inoculations, they have occurred, therefore awareness is prudent. Many side effects are delayed and will manifest outside a medical facility. Therefore, individuals and caregivers need to be vigilant for indications of potential adverse events. I want to learn about vaccine side effects. How do I do that? Information abounds. Differentiation for relevance is challenging and complicated by conflicts and competition for influence from all mainstream and social media sources. Even scientific papers can be biased, and sponsorship of studies should be scrutinized. Informed consent is more than simply agreeing to a provider's recommendation. Awareness of potential consequences is essential. You can check the CDC website. However, the advisories reduce the perceived significance of these occurrences and emphasize the importance of getting vaccinated. The site provides no guidance on recognizing early signs of a potentially serious problem and when it is time to simply seek urgent medical care. Internet media reports are inconsistent and often sensationalized. Package inserts, the official product labeling, is seldom provided to patients. It is an excellent source of information but not easy to find online. Moreover, the information is technical and difficult to understand. Scientific publications are a great source of quality information. However, access without an expensive subscription is limited. Publications may be difficult to understand or interpret how important they are relative to other information. Without specialized training, people cannot confidently differentiate between various types of studies or appropriately weigh the evidence that they present. CDC Wonder is the official public interface of the VAERS database. Without specialized knowledge of the terminology and the database structure, a visitor is unable to find all relevant information from a query. According to the CDC, the side effects seem to be trivial and nothing of concern. Hypothetically, 1 in 1,000 may seem rare until you consider 1 billion worldwide vaccinations equates to 1 million instances for each potential side effect, with many occurring more frequently and which increases with each subsequent booster. Additionally, adverse events have been tracked to manufacturing and handling mishaps independent of trial information and test data included in the product labeling. What is VAERS? The Vaccine Adverse Event Reporting System, co-managed by the Center for Disease Control and Prevention, CDC, and the U.S. Food and Drug Administration, FDA. Its purpose is to detect new, unusual, and rare vaccine adverse events. Causality is not implied. and the frequency of occurrence is unknown. VAERS collects information on U.S. licensed vaccines since 1990. Physicians must report certain types of side effects that are listed in the VAERS table of reportable events following vaccination. Proven causal link between the side effect and the vaccine is not required. However, there is often a compelling correlation and incident numbers worthy of concern, warranting further investigation that may ultimately become added to the official warning labels. Knowingly filing a false VAERS report is a violation of federal law, U.S. Code 181001, punishable by fine and imprisonment. This graphic is of VAERS, the official interface CDC Wonder. The interface requires specialized knowledge of the terminology and abbreviations used as well as the data structure. The system is primarily used by vaccine manufacturers and is not optimally intuitive. VAERS Explorer. What is it and why? Going directly to VAERS through CDC Wonder is not necessarily helpful. Slightly over 100 basic vaccines are tracked in VAERS since 1990. Many childhood vaccines previously administered separately are now bundled together, triggering a different immune response with additional potential for side effects. Consequently, formulating a query in CDC Wonder may not return all relevant data. VAERS Explorer has screened and correlated various data fields to enhance retrieval relevance and consistency. VAERS Explorer is a website application that makes data from VAERS available to the public and has significant utility for healthcare professionals and researchers from many disciplines. The interface is intuitively accessible to the public while maintaining formality of terms and structure familiar to healthcare professionals by uniquely organizing symptoms using the measure hierarchy and terminology by organ class to intuitively categorize the approximately 7,000 symptom terms within VAERS. The Value-Added Resource page lists package inserts and adverse events of special interest using Brighton collaboration criteria. VAERS Explorer facilitates verification of claims made in the media, enabling anyone to be their own fact-checker while advancing vaccine literacy. It is commonly accepted that adverse events are underreported for many reasons. Therefore, VAERS Explorer provides rich resource augmentation as additional decision support. VAERS Explorer empowers people to make confidently informed decisions for themselves and those in their care, appropriate for their specific circumstances. A series of selectable filters populate graphs augmented with tabular data. Query results may initially return hundreds of relevant cases, which can be further differentiated so that the most relevant can be selected for output. Graphs contain standard description and total case counts to substantiate the significance of those cases selected for output reports. Diversity differentiation within VAERS is primarily by age and biological gender. However, there are other environmental, lifestyle, and ethnic influences on gene expression that affect metabolic responses to drugs and vaccines not differentiated within VAERS that we include in our resource page. Managing healthcare for self or extended family comes with many questions about vaccine benefit and risk. Which vaccines are essential for my first grader? Should my 12-year-old son get a COVID vaccine? What about my teenage daughter and HPV or her long-term reproductive health with COVID? Aged, immunocompromised, or pregnancy vulnerabilities, are they relevant? Vaccination-dependent travel restrictions existed before COVID and have implications for all demographic profiles. Although incomplete, significant development has occurred, which enables what we can offer now. Custom reports to your specifications differentiated by age and gender. Symptom selection using measure hierarchy. A series of graphs showing filter view of VAERS data by specific vaccine or combination of vaccines. Other filters differentiate by adverse event category, seriousness, and consequence, which results in a highly relevant collection and presentation of actual adverse event case information. Tabular view of adverse events with relevant details which complement graphed visualizations. FDA-approved package insert for the queried vaccine as the official document that details all information about the vaccine and potential side effects to date. a list of side effects of special interest in accordance with the Brighton collaboration criteria relevant to the queried vaccine, custom queries that can differentiate between specific vaccine technologies, and access to the resource page, which includes cases and articles of special relevance, international studies and academic publications, and official product labels, litigations, etc. To illustrate a probable line of inquiry, we will use which infant vaccines are linked to serious side effects. You may want to know which infant vaccines are associated with the highest number of adverse event reports, and what is the seriousness of these events. All adverse event categories are selected to demonstrate that the most frequently reported incident may not be the most serious consequence of concern. Consequently, we will emphasize death, disability, life-threatening, and long-term hospitalization to identify 5 vaccines of interest to further develop this inquiry. The table on the slide organizes typical childhood vaccines by seriousness. These are separate adverse event case reports and are not redundant or overlapping. However, this slide illustrates how a query return can be misleading. The highest number of reports was for emergency room or emergency department visits. However, this in itself does not equate to a serious level one would give for disability, death, or life-threatening. Therefore, a follow-on query looking specifically at those vaccines with the most severe consequences is necessary. To advance this line of inquiry, we now look at what symptoms are most commonly reported for childhood vaccines with the most severe adverse events. The 5 selected vaccines are expanded to indicate adverse event signs and symptoms and numbers of event reports. At this level of resolution, the information becomes more meaningful for indications that a person within your care may be potentially reacting to the vaccine as opposed to manifesting a new ailment. Because VAERS data show correlation, not causation, it is important to consult the official product information of the vaccine for known side effects. Does your experience or observation conform to known effects or reported events? Here we have selected one of the 5 previous vaccinations to move from a general to specific inquiry. Revising the filters on seriousness will better focus data retrieval and the resulting graph. This information is now useful for determining a date of vaccination relative to planned travel, so that onset time or recovery can occur prior or be delayed until return to ensure access to an appropriate medical facility should a reaction occur. The most commonly reported serious symptoms for the Haemophilus B vaccine in children under 5 includes pyrexia or fever, convulsions, vomiting, apnea, agitation, hypotonia, and cyanosis. This is a tabular view of the previous graph. In this table, pyrexia, more commonly known as fever, requiring hospitalization has the highest correlation and may be more obvious in the table format than in the bar chart. This is why VAERS Explorer enables multiple formats for visualizing the data. What are the adverse events reported for individual and bundled MMR vaccines? In this chart, it would appear that the bundled vaccines represent higher risk than the individual vaccines. However, the reality is that the bundles are more commonly administered, and comparisons are not possible. Consequently, comparative risk-benefit cannot be extrapolated from this data retrieval. With refined seriousness criteria filtered, this chart shows the most reported serious symptoms following MMR vaccine alone or in combination among children under 5 years of age. This general inquiry could be further refined by 3 different age groupings or gender for a more discriminate or specifically relevant result if planning a vaccination schedule relative to scheduled activity. This tabular view of the data complements the previous slide and will be attached in a Phase 1 custom report. This table shows actual VAERS case IDs. In Phase 2, it will be possible to export a full case narrative for each VAERS ID. This is important to find the most appropriate adverse event profiles of research interest. What are the most common serious side effects linked to the HPV vaccine in teenagers? This slide is included to demonstrate that every vaccine has adverse event reports within VAERS. All vaccine queries have relevance within the VAERS database. What are the most common serious side effects linked to mRNA COVID-19 vaccines in teenage boys? This slide presents a demographic profile that was sensationalized in media reporting for adverse events from COVID-19 vaccines that stimulated additional research, ultimately adding myocarditis as a known effect to the official product label. What are the most common side effects linked to mRNA COVID-19 vaccines in females within reproductive age? This slide shows a range of reported symptoms for another sensationalized demographic profile. However, VAERS does not have long-term information specifically relevant to reproductive health and necessitates review of additional studies to support any conclusions. We have compiled relevant materials on our resource page, which specifically includes a pregnancy registry for COVID-19 vaccines. How many instances of abortion and stillbirths reported in VAERS are associated with mRNA vaccines? Integration of measure hierarchy allows discrimination of VAERS symptoms using specific medical terminologies organized by system organ class to fine-tune inquiry retrieval and selection of the most appropriate VAERS cases. VAERS currently has about 7,000 medical terms for reported symptoms. With integration of measure hierarchy, searches can be simplified by selection of an organ class, allowing an automated grouping of all relevant reports. For example, blood clots could be selected, and the full spectrum of relevant terms could be grouped together for review and individual selection. Then only the most appropriate ones would be retrieved for consideration and final report output. This is a tabular view of the previous slide that illustrates the range of terms associated with abortions, but shows that all relevant case reports would be identified and made available for consideration. VAERS Explorer Phase 1. The previous graphics provided a sample demonstration of VAERS utility when accessed with an optimized interface and competent guidance. The objective of Phase 1 for VAERS Explorer is to complete the public access portal so that individuals can generate their own queries and reports. At this time, Phase 1 report outputs are approximated manually to demonstrate and deliver the potential utility of VAERS Explorer. Our resource page will be continuously improved, but pre-deployment access is included with a donation to this GoFundMe effort. VAERS Explorer Phase 2 will add analysis of symptoms by system organ class using measure hierarchy, 3D visualizations of complex query data, full narrative report generation for each case, components of causality assessment to be included in the additional narrative statement, a series of graphs showing filtered view of VAERS data by specific vaccine, dose, or combination of vaccines, expanded resource page to include clinical trial information, automation and inclusion of custom report features from Phase 1, adverse event reporting to VAERS, which includes components required for causality assessment. We believe vaccines are an essential component of any health management plan and that they will be best incorporated with full awareness of potential adverse effects so that individuals and caregivers can be vigilant in detecting and responding appropriately to optimally reduce risk. VAERS Explorer, in conjunction with supplemental resources, will significantly increase confidence for healthcare decisions relative to vaccination. We absolutely appreciate any financial assistance you may provide to help make this capability publicly available and offer a value proposition for this funding drive. For your donation of $50, you will receive a custom report that includes a series of graphs and accompanying tables of side effects and seriousness by selected vaccine and demographic profile, official product information with known side effects, precautions, and warnings for a vaccine of interest, a list of adverse events of special interest for the selected vaccine, login access to our resource page which includes elaboration on vaccine safety beyond VAERS data. Thank you for the time you have given to listen to this presentation and your consideration of VAERS Explorer.